Okay, everybody, we're ready to get started with the second part of the webinar. If there's anyone who's just now joining us, just a reminder that during the presentation, we're going to have everybody's phone be muted. We're asking you to please keep your phones muted. And if you have a question, to type it into the chat box in the Adobe Connect space. We'll be monitoring that closely. At the end of the presentation, we'll provide an opportunity for people to ask questions live. You can use the raise your hand feature in Adobe Connect, and we'll call on you and we'll unmute your phone. Or you can also just type your questions into the chat box. We will have a question and answer period at the end of the presentation. We should be finished up by 12 noon. And so at this point, I'm going to turn it over to Roger Spa, who did the bulk of the work in developing these tools. Also, again, a big thanks to Tanya Luciao, who is doing all of the sort of technical work around making the webinar happen today, and is also recording the webinar for you to watch in the future. Hey, Roger.
Hello, everyone. I should have just shared the agency data tool. This is the second part of our webinar today. This is the tool that the agency will use to ultimately report their performance measures to PCCD based on the data that is collected here and also the data that's imported from the Clinician data tools that we talked about earlier. I'm not certain how many folks have come in just the second half for the agency people, so I will be reviewing a few particular generalized notes about the data tools that we develop here at EPIS. The first is that with all of these tools, many of the cells in the spreadsheet or the worksheet tools are locked to avoid accidental data entry, and we'll talk a good bit throughout the presentation about how to enter data and also some other common mistakes that happen in Excel when you're completing data in these tools. In a general sense, cells that are highlighted or filled with a background of yellow in the spreadsheet is where data is entered by the user. So you'll see that as we progress through the spreadsheet tabs. Cells that are not yellow, they're typically white or sometimes gray. That's auto-populated data that will be populated at the appropriate time based on the other data that's entered or imported into the agency data tool. I'm going to re-mention that it's important when you're correcting data entry errors in these spreadsheets that you use the undo feature in Excel. There is an icon for undo in the very most, when you have Excel open, in the very top left corner, you will see an arrow that sort of points backwards. That's the undo. You can also use the shortcut key, which is holding the control key. That's the one that's labeled CTRL, and hitting Z. That's the shortcut, the Windows shortcut for undo. So you can either click this icon on the top left, or you can hold Control and hit Z, which is undo. And we'll talk about that a little more specifically and show you a clear example. Also remind you to keep a backup copy, so when you're about to do a significant amount of data entry on any particular day, it would be best to save this with the backup of the current date on it before you start your daily data entry. That way you have something to go back to if you have any significant problems. The last thing for those who are not very familiar with Excel, worksheets are workbooks, are composed of worksheets, also sometimes known as tabs. You can navigate through those at the very bottom of the spreadsheet. And you'll see them labeled, and we'll go through these sequentially as we move through the agency data tool, and I'll explain each one of those to you. So the first tab in the agency data tool is the instruction page. This can be printed out in hard copy for reference on your desk, or to send as a Christmas greeting card if you like. If you're just so excited about data that's your style. But that can be printed out. Also, at the bottom of the instructions tab is a link. This is a survey that was developed also by the Epicenter to get any feedback about issues that people are having using the data reporting tools, or to provide suggestions for future potential revisions of the tool. So this is an active link. If you click on it, it will open that survey in your browser. So you can do that in the tool. If you in the midst of working on things, if you'd like to make some kind of comment or you're having some sort of problem. You can also always contact your Epicenter prevention coordinator for direct assistance about trouble you may be having with these tools. The next two tabs are where we collect all of your performance measures throughout the 2-year life of your grant. You'll notice that there's a Process PMs tab. Those are typically counts of how many things you do. It's the count of your activities, like pre- and post-test surveying, attendance, and things of that nature. Outcome PMs are the changes in skills and behaviors that we hope to see typically in our participants of the program. So I'm going to jump to the Process PMs tab. So this is the first example you're going to see of some of the yellow cells that I talked about just a bit ago. So this information at the top of the Process tab is some general information about your grant. So you'll notice that there's some text already put in here about inserting your agency name, the contact name. This should be the person who an Epicenter data person or prevention coordinator would contact if they had questions about the data contained in this after it's turned in to PCCD via an eGrants attachment. You'll also see your grant number should be entered here. The grant county, this is an open cell, but typically it should be the county of origin of the grant, so where the agency is located, the county that the agency is located at. The most important cell maybe in this entire spreadsheet is to get your grant start date configured appropriately. There's just a default date in here of January 1st, 1999. I'm going to go ahead and immediately change this to 7/1/2015, which is the start date of the grant for most of the folks that are on this call. And last but not least, insert grant year. This is sort of an open cell to add a little additional information. You can put year 1 or year 2 based on your reporting time period if you'd like. You'll notice when I had changed this date in this yellow cell that these headers all changed over the 8 quarters of the grant. So you'll see year 1, quarter 1 through year 2, quarter 4, and also based on this start date, the appropriate beginning and end quarters and year of each of that quarterly data. So as I mentioned earlier, the Process tab is about counting how many things we do. There are 4 items, or 4 performance measures here, process performance measures, that will be entered by the agency in these yellow cells. So the first example of that is the number of clinicians trained in TF-CBT. I apologize for some of the text being cut off. I had to reduce the size because of the resolution of this screen so that we could see everything. If you're zoomed out on your screens to 100%, it'll look fine for you. But I'm going to reduce it again so that we can see the whole way across. The second is the number of clinicians sorry, I'm having trouble seeing it myself, who receive certification. So these numbers will be entered in manually by the data person or the coordinator of the program. And if there is 0, anytime you have nothing to report, so for instance, no clinicians were trained in a particular quarter, you want to make sure not to leave it blank, but enter a 0. That's how the quality improvement folks here at EPIS know that you intended a 0 and didn't accidentally leave something blank. So just below that section of numbers that the grantee will manually enter, you'll see that these are all auto-populated data fields. So again, these are the 8 quarters of the grant. There's a cumulative column that totals across in all of these cases. But some of these other performance measures are number of new cases open, new cases closed. These are all auto-populated from the clinician data that will be imported from the Clinician tool that we talked about earlier into this tool and then automatically populated in these areas. So we'll talk about that more specifically as we move on. But the very end section of the data tool is a little spot here for you to enter some notes. So any comments about challenges or trouble that you had collecting or entering data in a particular quarter. This is just a little place to keep some notes. Those will be passed on to PCCD and eGrants when you attach this there. It will also be seen by your prevention coordinator as we accumulate this data and roll it up into the larger statewide initiative reports. So that's pretty much it for the Process PMs tab.
Rod, can we just quickly, I want to just walk through the different performance measures just so everybody is clear, and also point out that there's a little red flag for each performance measure, and if you hover over the performance measure, it'll give you a description of sort of a little more detailed description of the number that we're looking for. So in the case of those yellow-celled performance measures that you're going to enter the data yourself, it's important to just read that description and be familiar with what we're looking for, particularly so that we don't double count. Often for those performance measures, we're looking for you to report information only one time for your grant. So, you're going to only one time, for most of you, you're going to have a chunk of clinicians who are trained at that September training. You're going to put a big number for quarter 1, year 1, and then you're going to have zeros the rest of the time for that. So it's just important to read those directions. We're tracking number of clinicians trained, number of clinicians who received certification, and we are looking to understand how much work you're doing in terms of contacting referral sources as part of your work to build support for your TF-CBT program. So if you haven't been keeping track, at this point I'd like you to really make sure you're keeping track of how much work you're doing to reach out to different stakeholders so that you can report those meetings and contacts in the spreadsheet. And then finally, we ask you to report the number of times you present information to a collaborative board, particularly if that's a Communities That Care, a CTC collaborative board, but it could also just be another collaborative board that you work with. And that's around making sure that you're linking back to your county's strategic prevention plan as part of a solid public health approach to prevention for the state. Then the next set of performance measures is those are automatically calculated based on data entered in other parts of the tool. We want to track the number of clinicians who you would expect to participate in consultation calls, and then the number of clinicians who participate in 75% or more of the calls that you have scheduled. We're going to look to track the number of new cases that were opened, the number of cases that were closed, the number of closed cases that completed treatment. So if you think back to when we did that review of the clinical data tool, where your clinicians can select whether a case was completed, or they dropped out, or they were referred to a different service, this field is only going to count the number of cases where your clinicians indicated that treatment was completed. And then it's going to calculate the average number of sessions that it took to complete TF-CBT, and it's going to calculate only for those completed cases how many received all of the core practice components. It's also going to count the number of completed and analyzed CPSS scales, pre-post measures that you entered. And again, just keep in mind, it's only going to count 100% completion. So it's got to have every item on the pre and every item on the post with a response. If you have an incomplete measure, it won't be counted here. And then finally, we're going to look at the number of completed cases that started TF-CBT with a score in the clinical range. So we get a sense of sort of are we hitting kids that are scoring in that clinical range on the CPSS at pre. So those are our process performance measures for TF-CBT, and we would love your feedback on these. So, if you have thoughts, you want to give us feedback using that Qualtrics link in the instructions form, please let us know what you think. And I'll turn it back over to you, Raj.
Great. Thanks, Leanne. I appreciate you being able to add the program context as we proceed through here. So the next tab in the data tool is the outcomes performance measures. First thing you'll notice here there are no yellow cells. That means no data entry is required on this particular tab. All of this data is populated from other data, either imported or entered into this tool. However, that does not mean to not frequently check and review this tab, particularly when you import data as you're getting ready to turn it in on a quarterly basis by attaching it to eGrants. You want to check this and make sure that the numbers appear to be populating correctly for you. If you ever have any questions about that, contact your Epicenter Prevention Coordinator and they can help you through that. So Leanne, this information at the top is carried from the Process tab, and again, all of this is auto-populated, but I'm thinking you'll probably want to take a moment here to go through some of the outcome measures.
Yeah, thanks, Roger. So these outcomes measures are based primarily on the CPSS tool. We're looking at the number of youth with a decreased score in overall PTSD symptoms. So that's items 1 through 17 on the CPSS. And we've set the bar right now for the purposes of our pilot. We've set the bar fairly low at simply a decrease in score of 1 point or more will show up right now as youth with a decreased score in overall PTSD symptoms. And that's true across all of the constructs. So we've also got the number of youth with a decreased score in impairment. So those are the yes or no items for, I believe those are numbers 18 through 24. The number of youth with a decreased score in re-experiencing, and that's related to items 1 through 5 on the CPSS. The number of youth with a decreased score in avoidance, that's items 6 through 12 on the CPSS. And then the number of youth with a decreased score in arousal, and that's items 13 through 17. And then finally, what we've done is taken a look at the number of youth who completed TF-CBT, who had a pretest score in the clinical range at pre, who then scored in a non-clinical range at post. So we're looking to get a sense of, how many kids that you're treating move from clinical to non-clinical, and that's what this performance measure should show.
Okay, so that's your Outcomes Performance Measures tab in a nutshell. The next we have the Clinician Tracking tab. So this is where the coordinator or the data entry person will keep track of a few key elements about your clinicians. So in this case, I'm going to put in a little piece of information here about Leanne. I hope she doesn't mind. When were you trained in TF-CBT, Leanne?
Well, I got to go to 1 day of training in TF-CBT, Roger. 9/25.
I think because we're going to assume that this is during a grant cycle, I'll go ahead and put you within the I'll get you a fake date here within the grant cycle. Okay, so Leanne happens to be our only clinician in this particular implementation of TF-CBT, but she's participating in consultation calls. So we're going to say that Leanne participated on her first consultation call on July 30th of 2015. And then the way we track how if the clinician participates or does not participate in these calls is simply by choosing either yes or no. You choose yes or no if the clinician was expected to attend this consultation call on this date and they did attend, and you would choose no if they were expected and did not participate. So you can see by me switching between those two choices, Leanne either has 100% participation in consultation calls or 0% participation. Let's give her one more chance here to participate on one on August 1st of 2015. So we give her a yes, and you'll see again, this just automatically and instantly keeps track of the total attendance for that particular clinician. These not applicables are just because there's no other data or information put in there. Last but not least, you'll notice the choice of not applicable. So let's say that there was one more call on 8/15 of 2015, but Leanne had potentially already completed her consultation calls as needed or was ill on vacation. You can place a not applicable in there. Particularly, this is important when clinicians begin or end, because if you put it in not applicable, we know that the intention was not missed, there was not missed data that you actually put in not applicable because that person either wasn't anticipated participating there, they've maybe already left employment or completed the process, but it helps us to know it wasn't accidentally left blank. So if you can, please choose not applicable when yes or no don't apply.
This is also, just a note, the yellow cells at the top where you put in the dates for the consultation call, we've actually built this out to accommodate up to, I think, 50 different consultation calls. So I know for some of you, you're managing more than one consultation group for your grant. You can put every consultation call for your project in that yellow field at the top. And just simply list all of your clinicians, and if they were supposed to be on that call for that consultation group, then you'll enter yes or no about their attendance. But if they weren't supposed to be in that call because they're on a different group, a different schedule, then you'll just select that NA. So this tab will actually allow you to track more than one consultation group. So it's pretty flexible in that way. And I would also add, Raj, just if someone's supposed to be on the call and they are ill or they had to go on vacation, that actually should be indicated as a no, meaning that a call was scheduled and they couldn't be there for whatever reason, and we understand that. The expectation is about 75% participation. If you have, over the life of the grant, we are looking to make sure that everybody gets certified, and we know that participation in 9 out of 12 consultation calls is required for certification. So at a minimum, that's what we're looking to have happen, and that is actually 75%, 9 out of 12. So that's why we've set the bar at 75%. That's the sort of level at which we're going to report satisfactory participation. Then within this tool, our thought was that supervisors can sort of take a look to see, are clinicians on track for their participation and being able to get certified? And if they're not, then that gives you a chance to sort of take some steps to make sure that everybody takes advantage of the opportunity to get certified during the grant. I see that we have No, Brooke, the percentage of calls attended is not going to look bad or impact your ability to get certified. From TF-CBT's perspective, it's simply participation in 9 out of 12 calls. This tracking isn't going to link to the TF-CBT official certification process. So.
Yeah, it's really more tracking those process measures to help the agency as a whole assure that everybody's on track. At the far right, if you scroll over, there is some additional summary information for a number of yeses and nos for each of the clinicians, the number attended. So when this number is approaching your 9 to 12 calls that would be expected for the certification process, it's a quick note, a note for the coordinator of the program that folks are approaching those those milestones. Okay. So I probably could have mentioned this earlier, but the next tab is a navigation tab. We've added these navigation tabs to both the clinical and the agency tracking tool, but this is a way to quickly navigate around the spreadsheet. So you'll notice when I'm on a tab like the Clinician Tracking tab, in the top left corner in cell A1 is a Navigate button. If you click on that, it will immediately take you to this navigation tab, and once you're at the navigation tab, it provides all the shortcuts to any of the other places that you'd want to immediately get to in the spreadsheet. So here's the instructions, the Process PMs tab. You can immediately jump to those. Again, by clicking Navigate, you can jump back to the Navigation tab and jump to the Outcomes Performance Measures tab. So you can quickly get around the spreadsheet by using a combination of those clicks and hyperlinks embedded within the spreadsheet. The names of the clinicians, as you enter them on the Clinician's Tracking tab, are also entered here. So the next big and very important step of managing the agency data tool is bringing in the data from the clinician's tool into the agency tool. So we're gonna proceed with demonstrating that now. And so this first link you'll notice is Clinician Data 1. The rest of the tabs in this spreadsheet, CD1 through CD25, are where you would import the clinician data from the clinician tool. So if I either click on this Clinician Data 1 tab, that's where I'll be pasting the first clinician's information. If I was back on the Navigation tab and I clicked Clinician Data 1, it would immediately jump to that same tab. So as I jump back and forth, entering or pasting, importing the clinician data, I can jump around to the various tabs. So that immediately jumped to the Clinician Data number 5 tab. So I'm going to jump to Clinician Data 1, and I'm going to slowly step through the process of how you would actually take the data from a clinician's tool and paste it into this agency tool. So the first thing I'm going to do is jump over to the clinician data tool that we were using in the first webinar, because this does have some sample information in it. Again, I can use the Navigate button to immediately get to the data table, which is the very last tab in the spreadsheet, even beyond Client 25. I'm going to highlight the data that's applicable. So you'll notice that there are 3 cases so far with some sample information here. I could select all of this data if it was mostly filled in, if there were many, many more clients in here. In this case, we only have the first 3 clients in the tool. So I'm going to highlight by clicking in the B. So you'll notice that the arrow turns into a down pointing black arrow. So when you do that in Excel and then drag across, it selects the entire rows. That's different than selecting information in a particular block. So if I select by pointing at the column B, dragging across for all the appropriate cells, And then in Excel, you can either click this copy button up here. It looks like two little pieces of paper beside each other. I can also point at the selected area and right-click. There's also a copy command in there. So I'm copying this information from each clinician's tool. I'm going to jump back over now to the agency data tool. This is a clinician, this was actually based on your information, I think, Leanne. So it's actually Clinician 2. I'm going to right-click into this cell, this first cell, D1, and the most important thing that you will do in this is make sure that you paste values only. So down here, when I right-click in this cell in order to paste this information in, there is a choice to paste values only. That's the choice that I want to use. If you use the paste button in Excel, you'll also find that same. Here's the values. It's simply a little clipboard with the number 1, 2, 3 on it, and you want to use the most simple one. So I'm going to go ahead and paste that information in here. You would repeat this process for each clinician, bringing their total amount of data from their clinical tracking tool into the agency tool. When you do that and you go back and take a look at your outcomes or your process measure tabs, you will see that any data in the applicable quarters will be populated for you now. You're seeing the average number of sessions for those clients that were imported into the data. You'll see open and close dates in the data here. On the Outcomes tab, you'll see which youth, based on the CPSS, qualified for expected or positive hoped change in these various areas. And that's all simply from the copying and pasting of that one table of information from each clinician into these data table tabs. One more little built-in feature of the spreadsheet is another little data check. On the navigation tab, you will remember that I pasted in some fake information with Leanne as the clinician. So this is the name that was put in on the Clinician Tracking tab. Just to the right, in Clinician Data 2 tab, it automatically brings in Leanne's name as the clinician in this case. So that actually, you should see a matchup across here between Leanne's data tabs and the last and first name. These are not yellow cells, so you don't type that information in here. When I would import my data, Roger Spa's data here, my name would appear here because in Clinician Data 1 tab, my name would actually be in here as the TF-CBT therapist as I imported that information. So again, when you're importing this data and you copy it from a clinician's tab, you can come to this navigation tab and jump immediately to that particular person's tab and paste in their data. So I know that'll take a little bit of getting used to. Your prevention coordinator at the Epicenter would always be willing to help you out with that importing process and when you're getting ready to do that. So having covered most of the technical aspects of the agency tool, I'm going to pass it back to Leanne first and see if she has any wrap-up comments or things to say before we open up for further questions.
Sure. Roger, can you go back to the Outcomes Performance Measures tab? Because I just want to point out a couple things. So we see that we had 2 cases reported in my sample clinical data tool, and I purposefully made one of them end in December 2015 and another one end in March 2015, so you could see that how that data is automatically going to populate based on the quarter in which the case ended treatment and was reported as being complete. So that's a really key date within your clinical data tool. So, the quality of the data that clinicians are entering into their clinical data tool is going to directly impact what your data looks like in this summary. So, what's crucial is that we make sure we get those treatment start and end dates and the completion status correct for every case. Now, Roger, if you click over to the process PMs, I wanted to show folks that you can see that we've tracked when cases open is sort of independent of when they close. So in the case of the sample data that's been imported into this agency tool, both those sample cases that I entered started in September of 2015. So you see that we had 2 new cases open during that quarter. But one of them ended in December 2015, and the other ended in January. So the data for the case populates where it ends, but the data for when the case is open is going to show up in the quarter when it was open. And that's all going to automatically populate for you, so you don't have to think about that. What you do need to think about is checking to make sure that your clinicians are entering the data correctly in the clinical data tool, so that when you bring that data in, it accurately reflects what's happening in your grant. One other thing I wanted to highlight, Roger, if you go back to the Clinician Data tab, Clinician Data 2, CD2, yeah. So what's going to happen is that each quarter, we're going to ask you to look at each clinician's clinical data tool and import all of the cases each quarter. So you would just essentially replace any data that is in this tool with a new copy and paste for all cases. What this is going to do is it'll allow you, for instance, with your next report, you can go ahead and import all of the clinical data that's been entered to date. Even if the cases haven't completed, we can go ahead and pull those in just to practice. But then, when you go to do your next report for April 20th, you're just going to copy that clinician data again and bring it in and replace the data that's currently in here. I think that at this point is it for my sort of add-ons, Raj. So maybe we can open it up for people if they have questions. So go ahead, folks. What are your questions about this? I don't know if it's a good or bad sign that nobody's typing or raising their hand. Does it seem like something that you're going to be able to, okay, Abby feels comfortable with the tool, great. I do think that there's not going to be a lot of data that's going to populate in your January 20th report, because I would imagine that you don't have too many cases that have completed TF-CBT yet. Oh, great. Peggy's raising her hand, so we'll go ahead and unmute Peggy so she can ask a question. She'll have to unmute herself. Oh, Peggy, can you go ahead and unmute yourself so you can ask your question? What's that?
She has to click star on her phone.
Just click star on your phone. Oh. Hi, Peggy.
Okay. Hello.
Hi.
Hi. This is not Peggy. This is Steve.
Oh, hi, Steve. Sorry.
Hi. With Peggy, and we're here. Just a couple of clarifications we'd like to make about. One was there didn't seem to be any distinction between a youth CPSS and a parent one. For some younger children, we're going to use a parental score, right, for the CPSS. But by and large, you want the child's CPSS score. Is that correct?
Yes, we want the child CPSS score. We have not been able to clearly identify a parent CPSS tool that's been approved by the developer. I did reach out to Dr. Edna Foa, who developed the CPSS, and she was very clear that there's not a valid parent version of the CPSS tool that we are currently using. So I would be curious to take a look at what you're using, Steve, and talk with you about that. We are aware that the current use CPSS self-report is not valid for kids under the age of 7 or 8. So
Right.
we realize that is a gap in our process, and it's something we're definitely looking for feedback on.
Okay. So, and the other question, I guess, or just sometimes from our experience, if when we're testing early on, we're doing a CPSS with a youth, like the second session, for example, and they're not feeling safe yet, and we really haven't been able to, we're still working on engaging them, that sometimes, that data is not very good for the CPSS. So sometimes we may retest later and get better data. So can we re-enter test data and kind of use that as an initial indication of the score? Because sometimes it's possible that if they're not feeling safe or they're minimizing or avoiding a lot, you'll get below the threshold kind of scores when you know they're more symptomatic than that. Does that make sense?
It does make sense. I think it's a really good question, and I think that we need to decide as a group how we want to proceed with that, and maybe look to get some answers from Dr. Manarino so that we can just uniformly approach that issue.
Okay.
So unfortunately, I can't give you a definitive answer on that now, but I promise to look into it, and we'll send out a follow-up email with some instructions on how to manage those situations. I can tentatively say that, I could see us establishing a window within which it's okay to sort of pre-test, if you will, and, a window within which it's okay to sort of do the pre, based on, waiting to make sure that you have the youth engaged. But I don't feel comfortable answering that right now. We'll just need to get a little more information and get back to you.
Okay, thank you.
Any other questions? Anyone else want to weigh in? Okay, so just again, a reminder that we'd really like the clinicians to start using the clinical data tool as soon as possible, get any of their open TF-CBT cases entered in there, and have you be able to give this a good, thorough test when you do your January 20th report. That will allow Roger and I to get a good sense of how the tool is working, and give you a chance to give us feedback on it. So we really appreciate your cooperation with getting going on using these tools. I know it's a little bit of a short timeline. We're not expecting it to go perfectly. And we are absolutely here to provide you with support. So please feel free to email us or call. We should have the link for this recorded webinar up on our website within the next week or so, I would think. Tanya's shaking her head. She's saying she can do it. She's a superstar. So thanks, everyone, for your time. And unless someone has any more questions, we'll go ahead and end our webinar early.